Okay, this is going to be our part 3 of the respiratory diseases. This is going to start with chickenpox. So chickenpox is caused by the varicella zoster virus, which is actually in the herpes family. So it's called the herpes simplex virus number 3. And the chickenpox name, that it doesn't really have anything to do with chickens. There's, various stories on how the name came to be, but it does not exist in chickens. It was, right, a common mild childhood disease, and there's a vaccine out for it now. How chickenpox works is that you get it through droplets, or you can actually get it through those little vesicles through your skin. Once you get the virus, it localizes in your skin, and then you have these vesicular. So vesicular means that there's going to be a water-like fluid inside. Pus, rupture, and scab over before healing. So the hallmark, remember, of your herpes viruses is that they are going to be latent. So these guys, the virus here, is going to be latent in your sensory neurons near the spinal cord and in ganglia. So the word ganglia is just like a little growth within a nerve. Okay, so if this is a nerve, the bulge that you see here is called the ganglia, and that's where actually the cell bodies of those neurons are. So the nucleus is here, and what happens with the sensory neurons is one very long axon goes to the spinal cord, and then the other axon goes to a part of your body. So the actual living sort of what's that living, but like the actual body, right, of the neurons are here, and that's where the virus is going to hide, right? So the virus is going to infect your skin and then slowly, move up through the nerves, and then it'll move up from your skin and then sort of take hold and live in the sensory neuron ganglias. And all those ganglias are near your spinal cord. So you can see there's one pictured here, all right? And with the initial infection, when you get chickenpox, you have a rash all over the body because the virus is all over the body. But then, the virus will take hold and go into the spinal nerve. Just like your herpes simplex 1 and 2 for, cold sores and the herpes lesions, something can basically stimulate it to come out of latency. And that's called reactivation. Okay, so here's our latent virus. It's in that cell body, and something, right? Number 3 here is there's reactivation. Reactivation can be very similar to the things that would reactivate the other herpes viruses. So it could be getting a cold, it could be like a hormonal shift, it could be stress. But then the varicella zoster virus will come out and basically travel along that spinal nerve, and just one branch of it typically, and so it causes like a reinfection in the skin later. So that's the second time, and that's called shingles. Okay, so the second latent disease of your chickenpox is going to be shingles. And since shingles, we looked at the pathology of how the virus kind of like lives near your spinal cord, and then it activates, right? And it just follows one of those branches down. So wherever that spinal nerve serves in the skin, will erupt. So you can see it's very like it's only like left or right side, and it's only like very quadranted out because it's limited to where the nerve endings will land. And just let me say one thing about shingles, that shingles is something that you cannot, you can't prevent, but it's not that everybody that gets chickenpox does not get shingles. So it's something that is sort of just sporadic within a person. And if a person were to have shingles and then someone else, it's still contagious. So someone else gets it. So this other, maybe a young person will get shingles from an adult who has the shingles outbreak, then they would get chickenpox, right? They would get the first manifestation of the virus. So chickenpox is a herpes virus. I want to be very clear about that because we're going to start talking about pox viruses, which is completely different. So pox viruses do cause that same kind of skin pustules. The pox viruses do leave scars, and you might see some pictures of that on the internet. I haven't taken any for the file here, but so the reservoir where you find pox viruses are in the wild, so they're going to be in domestic animals. Actually, if you look at the examples, there's lots of animals that have these pox viridae viruses. So we have cowpox, and that should feel familiar because we talked about how cowpox prevented other people from smallpox, right? And Jenner created a vaccine. And then we have monkeypox. This might look familiar to you because there was a monkeypox outbreak in New York that made the news. But there's also rabbit pox, mouse pox, camel pox, elephant pox, and there is smallpox. So smallpox is the one in humans, and it's actually limited to humans. It's not, smallpox is not anywhere else. And in fact, smallpox has been eradicated from the face of the planet because of the very aggressive vaccine campaign that we did. So when I say smallpox is only in humans, it's not actually in humans anymore. It's no longer in the general population. However, it is in 2 places, so they still have little stores of the smallpox virus. One of them is here in the CDC in Atlanta, and the other one's in Moscow in Russia. So the virus that causes smallpox in humans is called variola major, and it's been eradicated since 1977. I included the picture of a bunny here because you can see those like lumps under his skin, which is his rabbit pox. So cowpox and monkeypox have both infected people, right, symptomatically. And they resemble smallpox with those pox-like blisters, but they're less severe. In Africa, monkeypox affects children. In the United States, we just get outbreaks from people who come from other countries. And yeah, so that we can see that monkeypox might be on the rise. There's 30,000 cases of monkeypox in the United States. It caused 42 deaths. And so it's sort of like a sporadic case when people come across someone from out of the country. Or actually for monkeys that might be carrying the virus. So these are typical smallpox lesions. Just want to show you the progression of the smallpox lesions. And very, that those lesions, those pustules can transmit the disease. So the vaccinia virus vaccine, it is a 2-needled pronged using an attenuated virus. So this might seem kind of odd as a way of vaccinating. So it did stop in 1972. However, you might want to take a look on your older friends out there. If they were born before 1972 here, they might have a little scar on their upper arm to show you that they were immunized for smallpox. Yeah, so Atlanta and Moscow are where 2 little vials of smallpox exist today. You can read, there's a little blurb on that, the ethics behind still maintaining smallpox piles, and what it means to sort of everybody's safety in your textbook. This is a very startling picture, right? But we have a immune baby, and we have a mom who is suffering from smallpox, but will not pass on the virus because the baby's immune. And then we have our wrap up of our viruses. So we talked about chickenpox, we talked about the common cold and the flu, measles, MERS, German measles. We talked about SARS and shingles. Shingles is just that second latent disease of the chickenpox. I actually can't read this one because it's underneath the timer. So I think we did that one. All right, so we did viruses, adenovirus. Oh yeah. RSV. Okay. The next unit is going to be the fungal infections of the respiratory system. So there's quite a few. In terms of fungal infections, they're really common with either poking your skin and getting, something from the environment into the skin and then having a fungal infection. And the other most common way of getting them is going to be through inhalation, because the air is full of mold spores. And so, it's very, very common or easier to like breathe in a lot of mold spores, especially if you are working outside or, a farmer, or in the correct areas where you'd have like the conditions for these molds to grow. So in this picture, you have this mold. This is Aspergillus, which is on our little list. Aspergillus makes the spores, and then the spores are in the air, they get inhaled, and then they are, we have a mucociliary escalator, but some of them can get down into the alveoli, and once they get down here, of course, they're going to cause the disease. All right, so histoplasma is the first one we're starting with. The disease is called histoplasmosis, okay? And then the agent, the actual mold, is called Histoplasma capsulatum. And this is localized. So some of these molds are, found endemic in certain areas of the United States. So this one happens to be found in the Mississippi Valley. And the reservoir is the soil, as with many, many molds. And particularly soil that's enriched with bat or bird feces, which is called guano. So then the bird feces, if you have a lot of it, and that tends to happen, there's an area where birds will stay, or bats will like take up one, an attic, but due to that, you're going to have very, very rich soil in the area from all their feces. And so that promotes the growth of this particular kind of mold. It is not super pathogenic. So 60 to 90% of the population have anti-histoplasma antibodies. That means that they've been exposed to this mold, but most of them don't have the disease. It is considered a true pathogen, which means that it is going to cause illness in healthy people. Like, you don't have to be immunocompromised in order to have this kind of mold infection. Most other mold infections are going to be opportunists, which means that they are going to be causing disease in people that have a weak immune system. Most of the cases, like I said, right, 60 to 90% of the population have antibodies, so they've been exposed, but most of the people who've been exposed are asymptomatic, so it's not going to be an issue for most people. The ones that are affected are going to be very young and the elderly and the immunocompromised. That sounds like an opportunist, but it is a true pathogen. Oops, sorry. Okay. In terms of the disease, when you inhale the spores, it's going to mimic tuberculosis, and it does form the same kind of granulomas that tuberculosis makes. It does reactivate later when, if the person's immune system can't keep it within the granuloma, it breaks through and it enters the bloodstream to infect other organs. So this is really similar to tuberculosis. Okay, so we're going to keep on going. Coccidioidomycosis is the disease, and the agent is Coccidioides immitis. This is one that is endemic in our area, so it has the nicknames of either valley fever, San Joaquin Valley fever, or California disease. And it's basically found anywhere that it's hot, dry, salty, is carried by the wind, carried by animals on their skin. So you can see sort of like the path, like the area. And then this is known to be highly endemic. So this area of California is known to be highly endemic. And how you would get this fungus right into your body is to inhale the spores. It's going to go into your lungs, and then it makes a very characteristic spherule. So it's a multinucleated spherule, and this is basically the hallmark you would look for a Coccidioides immitis infection. It's really interesting because if you remember back to when we learned about fungi can be dimorphic, right? So some fungi in the environment, they will form hypha, and they'll grow within this mold form, right? And then sometimes they'll produce that little lollipop, and they produce the spores right off of that. That's in the environment. But once those spores get into the body at the temperature of body temperature, 37 degrees Celsius, they sort of live like yeast, right? So they're going to reproduce by budding, and they're going to take on the yeast form in the body. This guy is different. This guy is coming in as spores and is going to produce more spores. So that's an interesting and a unique thing to this disease. No complications, complete recovery with long-time immunity, and the immunocompromised can have a harder time with it. It becomes a systemic disease, can be chronic and lead to abscesses, nodular abscesses, and can be fatal. So this is an image of the spirule. Okay, so this is going to lodge in our tissues, in our lungs, and we can see all these round spores that are not stained, right? The spores are going to be the white areas. And this is a lesion, a nodular lesion of a person who's suffering from coccidiomycosis. An interesting little tidbit is that in 8 weeks, more than 200 valley fever cases were diagnosed, which is 16 times the normal rate of infection, because guess what happened? There was an earthquake. So in that earthquake, all the ground shaking, right? All the mold spores came up into the air and was in the environment. The cases, however, were heavily concentrated in the Simi Valley rather than the San Fernando Valley where the earthquake was centered. And why do you think this was, right? Because once those mold spores come into the air, just depends on which way the wind was blowing that day. So it just blew the air over to Simi Valley. And the valley fever outbreak led to hospitalization of more than 50 people and to 3 fatalities. So, right, so out of 200, right, 50 went to the hospital and there were 3 people that died. So it's not something that's, it's not nothing, right? It's a very important fungal disease out there that we need to be aware of. All right, then we have aspergilloma. This is not the nicest thing to look at, but it's a fungal ball, right? So that you inhale the spores, they come into the chest, your lungs, and then they form these really large growths called fungal balls. And that's typical hallmark of aspergilloma. Aspergilloma, or the Aspergillus genus. So there's many species here of the Aspergillus that can cause this to happen to you. It can give you allergies on the mild side, and then this aspergilloma is a ball-like mass. So that massive is what you can see here, right? And it's called an aspergilloma. So that gives you an acute pulmonary aspergillosis, and then from here, as we talked about, the lung is very delicate and has lots of blood supply. It can also leave the lung to invade the brain, the eye, the kidneys, and other organs. Our last, I think, fungus is Cryptococcus neoformans. This is a yeast in our body, and it is encapsulated. So you can see how large the capsule is, which gives it that virulence factor to make it difficult for our immune system. Cryptococcus neoformans is definitely an immunocompromised person's disease. It's an opportunistic disease, and just like our other histoplasma, it is found in areas enriched by bird droppings. So if you get Cryptococcus neoformans in your body, it can be asymptomatic. You can develop chronic pneumonia, and the most dangerous part is meningitis. If it's not treated, it can cause death. So this guy kind of gets into your, the cerebral spinal fluid within the membranes of your spinal cord in your brain. So that infection can be fatal because, of course, it's right next door to your central nervous system. All right, so wrapping up our fungal infections, we did aspergillosis, valley fever, histoplasmosis. We did not do that one. Cryptococcus neoformans. No. All right, so those were what we covered. And that's it. Okay, there are no protists of the respiratory system, so that's nice to know. All right, that's it.